Oko boy Bernard.
Chairman General.
Me who ache. Me who nche ba me who ofie ha che.
Amba. One correct and come chere bi enu ana tuisha.
Me nka kese. Me nka kese. Ne me kan say Oswald at 50.
Chairman say you are say we dey. Unim obi wan sema o tiem ana o kasa didi na o hia na o hwe ne din pe na wa ye din. Sana ya siti nti se na me hwe wi men ko ebia na wo ko no yes ah me na moyi me na me your doctor ni me ndru awofa ni ndru awodi iti
man hwe ni ye a asembe to me
wan hwe ni ye na ma che on the way na chama general
yes doc
ana pai mami fasi da manyankopon
amen
unse untan sra ana unko visitation hospital la wadwume wo so obi ana sorry ya wa bejuma o obi wo wa anapai wantima nko ejuma odampa so na sani pano se opie no obegina Peace FM kwan ho kra na ni age ana ni beji. What it means is that just coming to work nyame e bia ma na ya rezi ye Baptist Church no one of the most powerful words I heard teaching grace.
Adam.
Now grace no, you defining no undeserved, unearned favor and kindness. 2 words so undeserved, unearned favor and kindness.
Undeserved and earned
favor and kindness. Now, I say I didn't understand emfatao ana ensel. And onye juma so a e was say emfamao. But Nyankopon makes it available. Enti shin ensi ekra, we have to thank God for the strength we feel in our bodies and also thank him for the peace that we are enjoying. Unko other countries you can take things for granted, but these are basic things you can find a reason to thank God before you start your day. Until let me say thank you to him, and let me also manda nyamiasi no
yes.
So mi da wasipa
nyamiadum.
We are my senior brother. Sebi time I mean to monkey shoulder one crab on my now uchre odo di mami. There's a odo no enye odo bibi na bibi sebi odo ayato. Brofo be friend no intrinsic. Ana science me be ka say genetic. There's a omojam.
Omojam.
Nti be the asida kese na ema o.
Ye de nyamiasi.
Mpembebre no nkofo omuti su a omuti shine bebre pemasem. Enti da me hu so pemasem no anye me won bebre. O staff nso any o team production team. Mama ndo mo asi. De bia me ba omuti se mba pe. Omo nim de me pe. Mama me Hausa koko 1 cup. Bofo tinso kan ba me kan se anopa yi. Me yemu ha me kakra enti omo yiye no film.
Omo yi bofo dun film.
Enti me ko a me de be ko na take away.
Just say bofo tu ubeja momo.
David I happen na me ba me no Hausa koko. Enti me da mo asi. Mada o production team ase no. Mama nda me mami ba ko a odi mi tiye. O to me fu. A odo mi pa me so me do no. Honorable Osefrima Opari aye chief of staff. We mami ba ko pe. Me mami efrimu na nso I mean tan dia ro bebre because honorable Frima we asi. Ena wa onim first lady so.
Samira.
Oba ba ko a makoma wonu ho pa ono so atiase. Bra kwa me mienu we atiase die. Nyankopon ama we asi ayedede. Enti anopei Ghana for so etie o. Bi che obia me pai boni say you find a reason to thank God for being alive. Ena bibia AC ene no. Nyankopon boa o na niamanye kama.
Amen.
Going forward.
Obi Semin culture say you're a presec boy. Bring single malt right now and stop that plenty talking.
Okay, the Obisano, I don't mean to anything.
Honestly, a presec boy.
Say, baby, mo, sound drone, I may check your blood pressure. Any sugar and some mouth.
Now, who check your blood pressure and sugar? Yes, you check NHI. Or what to say?
Oh, first of all, no, and no, as we go, chow, papa.
President John Ejekum Kufuor.
Enti me call no anajuno ka che me say doctor na hi and I'm say oh me nam krom na meti say me ma me ye hwe na ye hunu. Enti ma be me bisa de ekoso and I see de meti na yampa.
Oh.
And I'm a man shedding. And on also o ma me shedding na as usual o ma me futu.
Yeah.
Bisa me say constituency saying and I see nimpa boni say Yankobo be boa me na bibia ye kama.
Amen.
Na President Kufuor bisa health insurance na me boni. President John Ejekum Kufuor and ohun say Ghana in the 1990s no. Otiya oya na o hospital na see malaria. Braka me uni sky di tua doctor ene drona. Doctor nim dey o na so obewu. Na ye friend no cash and carry.
Na doctor for you be work to rule.
Work to rule.
Okay, but you penom cause strike.
Na President John Ejekum Kufuor na Australia say say no. O call other countries omo okwan a omo ye the before friend health finance. Why e fa so ye tua for health care.
Yeah.
Enti or electing a team omo call around the whole world. Including first health minister under President Kufuor, Honorable Friye, Dr. Friye. Emma within 2-3 years,
Dr. Kwekwe
Friye. Within 2-3 years, President Kufuor di shishaye baya ebuwa yema sebi uyaria insurance wo ho a etua ekano ema. Na ye insurance ni brofo friend social insurance.
Yeah.
Sika otua no sebi enye sika edin. Na adiba kusa President Kufuor ye come and say 90% of funding for health insurance na free taxes. I the NHIL, National Health Insurance Levy. Enti 20 years down the line, this year health insurance ye wo no parliament wanya 20 years. Now at 20 years we have a lot of stories to tell, good stories. Ye were heroes to celebrate, workers to thank for all their hard work. And most importantly, ye were challenges to discuss. Now nyamia dom President Kufuor insurance or the buy up to now every President Atta Mills, President Joma, former President Atta Mills, former President Mahama omo nyina buy no omo antu engu omo bo modin say insurance no omo be shemu kena na nana President Nana Danko Akufo-Addo buy no ono so abema insurance agina ho didindin na 95% yes over yare oha e wo Ghana 95 and insurance e cover 5% the insurance and cover na ye be call me they say 5% na insurance and cover no ye say nkrofo start ye hu dede say ye mbo hu nkomo na ye mpe kwan a ye be fa so a eno so ye be finance enti asem dey wo no say ene no hospitals be bro dem kasa oh say there Dr. Koboy otuaye by nyanka SAS can I tell you? Ma asa kosoro.
Can maybe say it is saying.
Say you know. In fact, health insurance with the blessing of your board, led by Dr. Ernest P. Kwaku.
Hey,
Rakami.
You know natural.
Say nipa die. E o ma na wati take kakra. Na we pi. Enye sa hanta bi okita bibi no be wu nantie. Enti Rakami. Yeah. Board no approve e ma the policy bi about health insurance. Your friend is sunshine policy. Titi no before I buy Okoboy me buy health insurance. Sika ye tua hospitals na ye no wo kukurem and I can say undercover.
Kukwem.
Only health insurance. Any hospitals na nim sky di ma wo. And what me share doctor bi Osho hospital bi so. O share na o say ni ma say oh I feel 1 year ni Okoboy ma me hwe. Yaman ko yi. Now so bra ka me wa ko check in the account. Now last month Okoboy man sika. Enti ye the police way by say sika yetua all hospitals close to 4,000 facilities in Ghana every month ebe publish it.
More publish way.
Or your website.
Okay.
But me can say publish no na hospitals be publish just say doctor uye ni sa ngofebe hu sika do enya wan hwam Robert Square attack here.
Na de omo keep scan hospital.
Yo enti omo say me fa password enhye hu. Enti odo ya ye dia to website no. Just say password enti ye the password no ma Pharmaceutical Association for omo tondro because omo titi no omo say ya yentu on ska omo be hospitals omo si scan by enti omo password yama Ghana Medical Association password Yama Nurses Association password. Yama Ministry, Dr. Kuma Abuaji, I Ghana Health Service boss. Yama password. Yama private, Obia Bebre. Yama journalist. Yedima, I think one of my association is it GJ. So that money na answer beka. But still no. Ebi mu nsi so mukasa enti just Friday. And I share a decided say ye password ne free hu. Enti from this week, God willing. Except for private facility, private funding there, you don't want to take a crack.
Are they?
Say only so private facilities. Proprietors, owners, and say me 200 because check it say last week, Matuano Ebia 200,000 Ghana. A year be or becono one shot or can't say no more the Omunjin 80 private for there for now. Yedi atun chain. But all public and quasi facilities, my way. Yet two more brown say the two websites. No? So that Peace FM, muko na mu clicky file na ube sika sebi Manshia Hospital nyaye ube sika Suum Hospital nyaye any month so an isaka scan. Say no mu nyina jatu say o boy say die scan oba kama. Say omu si scan yesan tum na inflation. Look at me. Maybe I see you. You have to scan mu 2 times. In fact, health insurance, your finance department be catch me say sika yetuyama health facilities are cost through by about 40%.
Really?
In fact, some hospitals sika yetuyamu are double over sebi a facility like Confanoche. First, not sika yetuyamu maximum about 2.5 million Ghana cedis. That's the average cost of taking care of Ghanaians echo. Say omo bill now close to 3.5 on the average. Enti usha nkofo bebre health economists are advising me say doctor kwaya anamu amutu e unsustainable. Say obeka say mahwe we to scan mu na wa tum ebedru ebi no wan hwa. Sebi we health insurance we pay an average of 150 million Ghana cedis every 30 days.
150 million cedis every
30 days.
But that's like a month oh.
And I'm no monthly. And a lot of people have said doctor, weird kakra say in this country a population of about 30
150 million
every 30 days.
Really?
Yes. Every 30 days. Now 150 million is the average cost of bills I already bring or health insurance. Enti ninja kauna brakami ochinani sorry Thursday and Friday you're organizing the first health financing summit in Africa under the sponsorship of National Health Insurance, any World Health Organization.
First what?
First health financing summit. This is the first time over 60 countries in Africa. Eba Ghana in Komo Ayeboni say, Kwambe na ebe faswa, yebe achieve universal health coverage, which is one of the key pillars of the sustainable development goals. Brother, you see universal health coverage. The HR say, Kwambe nsu na obe fa say, obi yarea sika embeye barrier between nipa ni yare no any care was on den onya enti brother me uko UK sese a se oniso briw na to form na rush uko emergency a ye be hwew before oni be titi say wo hospital Ghana hanso uto form na wo health insurance a o chance e be hwew about 80-90%. But as we speak Ghana about 45% of the population are not on any form of insurance. 80 out of every 100, 45 are just working. Bibi your moi. Say osofo ana sebi politician ana philanthropist am a peer. Doctors version na we free. Enti the discussion this morning during this conference is to find out ways I bet me improving President Kufuor health insurance no dia ba no to make sure say kidney ni niama nkrofo kan ni nyina ya pe kwan bi so ama ye betimi aboa nkrofo ama mwanya access to health care enye access pebra kwami kwan be nsu na be fa so a Ghana ni bia ye be hu e bia wa ho ndi ngina so that ye betimi hu say o man we mu nkrofo 1 million and o blood pressure no enye nkrofo 100,000 and no blood pressure no malignant bro doctor say blood pressure malignant just say at any time want me tough from you can drop there anytime blood pressure above 200 or 200 120 and no pressure yet me call ultimate cry anytime in certain countries omo nim san crofo nyina enti Ghana had a rock I mean we don't know we have programs that we betimi start na I sure say ye ni mo bia blood pressure so that and sana obenya stroke abe boy e ka kese health insurance no ye betimi asuso ano. These are the discussions and no pay Ibrahim you engage yourself in health insurance as we prepare for the health
conference the health financing conference there be
welcome Mr. Thursday 12
yeah what there be
yes any 13th La Palm Royal Beach Hotel na adiba kwa yemi dani say welcome me wafa Uncle Kwesi Pratt and all mommy caution from your side and make sure me who ya ka say ye na
send na konya na artist
oh baba say na idea when say me we pay me jama
minim zaba
land owners na unse welcome
yanka conference yeah
yes you know on Thursday and Friday a 2-day conference
now say 60 countries
now the good thing is despite the challenges with Ghana no WHO picked Ghana as one of the countries you put in place a social health insurance abuama access akosro omun kase perfect but omun see at least if all countries in Africa will do that abe buama ohia any poverty akofom enti WHO penyinu Professor Chisaka Kasolu obesra me office me catch and say yeah the 20th anniversary I be a conference but see doctor I want to co-organize with you people.
That's nice
because already no they've been sharing our story everywhere they go so they want to be part of the conference and this is a jointly organized conference between the National Health Insurance Authority and the World Health Organization.
Are you saying that our health insurance ain't yet that bad?
Oh bro Kwame na
Esan is nipa bebre entire complaints about health insurance.
Next week, me call Lagos. Nigeria, Lagos State are sure to Ghana say they want our technical people to come and spend days with them, help them with how to work on claim submission. Tanzania ba Ghana koye and drew 2 months. Rwanda ba, Uganda ba, you know, a lot of countries. In fact, as for Gambia there, omu on their health insurance, they all came to sleep in Ghana to come and learn from us. Enti, we don't have a perfect system, but me, Dr. Koboy, I've worked in government hospitals before, Uko Lekma Anopei, I always say it. If 10 people go to Lekma this morning, 6 have been able to go to Lekma because they are holding the card. In our cities, 60 to 70% of all those who go to hospitals go there because they have health insurance card. 2 reasons. Even if the health insurance does not take care of everything, it saves them 50 to 60% of the cost of care. Who drive cost solar, who could do seshidia, health insurance accounts for 80 to 90% of all those who visit the hospitals.
Really?
Now, your research, when you know your research base, actually say, since President Kufuor need health insurance by access to health care, so be better not be hospital, across road. But and say perfect, we can still do more. Enti, this conference will enable us say be bon komo kwan be fa so a nkofo benya gidie wo health insurance no mu hospitals almost can cost. Look, brother me Mr. UK adiba kwa me wen say hospitals enye say o sorry na wo di nkofo 5,000 bills as a yentua when I'm sure no yeah population based financing. Yes.
Say
there brofo omo friend no capitation you know enti ye hwa Accra population yes Accra 4 million ya won say Kolebu about let's say 1/3 of omo yare na ya calculate sika average Kolebu be hwe nipa na ya pes can be about 60% dem Kolebu enti Kolebu the budget be say make sure you are in for emergency me your operation in a year me here be 4 million na ya 3 million ama Kolebu say fire ejuma at the end of the year no na year account how much you used. Kolebu to me use 4 million next year na amount the same 4 million or you see 6 million it also unjustify how you use the 6 million and you use the 6 million now here you bet me you 1 million be from Tema General assuming say a lot of people are not going there but are coming to Kolebu. But once you do that hospitals use their money with care and become efficient. When you know your other payment systems we can consider for now there Ghana is doing DRGs, IFN diagnostic related groups payment. Enti hospital we ba no say o me ye bra kwa me yiri cesarean section. Ye dey atu your bills say e betua 1000 na atu ano. Enti oba no say why 100 cesarean sections and no say atu ano 100,000. But elsewhere no
you better check it.
Yes, you better check it. Ya man 50,000. Enti say all your operation say I didn't know here on your operation. Say dey wan hwe kra udru hospital bi obi betimi age wo admit o because admission e na masika na yeren e kosoro.
Yeah.
Enti who hospital bi brother me who fa say wo bo wa pe wo beda because say wo da ne sika no be kosoro. And let me emphasize here, this is not a practice of all hospitals.
Okay.
Most of the hospitals are ethical. Omo yi omo nyama yi. But there were few hospitals about coming. Wo bo wa pe wo beda. Wo se uti ya wo beda because oda obenyeska. But anka ya man is car or the operator was so operating with that money nanka. Ubana ewana ubona nye serious obeka se Kofi na ba for review or chanapa. So all these are discussions they will say engage your attention. Now one thing I want to say is kidney dialysis from President Rawlings up to ene aban biambaya ya kidney dialysis brakami free from President Rawlings up to today. People have died of kidney related diseases. From President Rawlings up to today, people have died out of heart related conditions, including my own biological mother brakami. Me yesterday was Hamburg and my friend me say me mami wanya heart problem. Me share pictures in the pen and me say we asem kesiye. Just open heart surgery and I bet me saving brakami. Sika edi yes surgery na me nibi. And I said oh ni sa scan na untimi call hospital. Brakami and check we were German and friend me say we free within days. Now a lot of people have died, but enun say yentimi finance these conditions to leave the earth. All it takes is to have a conversation. Like we're having now. It is a conversation and come upon any advocacy say yeah bon come and a bet say point be na be fa so a you bet me aye den aboa sankrofono.
Okay.
Enti ene dialysis in komaba enye boni enu na be ma ya finances same way first lady Auntie Rebecca Ekufuado any parents of inkwara omo cancer omo no mo ya advocacy sa bra kwa me na ya kasai inkwara omo cancer about 4 of them ewo on health insurance before Ekufuado be president now ukwara wa cancer bra kwa me death sentence ni sika editor obewu say nyame adom ya hospitals omo di bills abre ya tua for nkwara omo cancer and na me do kasai Ghana for more mental health conditions, depression, schizophrenia, mania. Most of those conditions, the common ones, yeah, way to my health insurance, yeah, the babe 2 health insurance, so that obi etimu enye papa, nkobani say ebe jaino, na nitimu enye papa no, adani into physical illness. Obi wa mental illness, na enye obibia with time no, adani into physical illness. Wanye obibia. It can lead to death. Enti, and now we are trying to put mental illness onto the national health insurance.
Mental illness. Exactly.
And also in advocacy. Professor Osei, former mental health authority, Omupenyi.
Akwesi
Osei. One of the leading advocates for mental health. Ghana for Bebrinim, finance minister Niyiri. Professor.
Or a clinical psychologist.
Yes. Professor
Angelo Ferrata.
Bro, ultimately by my office, average twice every month. About see doctor how far. Enti say for bisa wa same year everyone. It starts a conversation and ultimately there is a solution. Enti dialysis makase yebetimi atua for dialysis. Honorable Kojo Ponkruma, onu no cabinet, me braka me post Andrew ho. What me say Minister of Health, Honorable Kokrokoo Ajimamenu, any president, ye the memos be to her. Ideas be some of us are suggesting any Aban ideas are going through discussions. One of the things Aban we can do is to send a year for all HIV medicines. I am free no. Aban can pay for some of the consumables for kidney dialysis. and member cost above from by over 70% because the input that determines the cost of the dialysis. Now abang toa and one say sebi ya monitor the thing strictly. Now both private and public hospitals. Ultimately, sebi apart from kidney dialysis, ultimately financial. So it can be done. Number 2, paying for it. Sebi, we can have a fund even outside health insurance.
But you're telling me it can be done. We can tell me, sir, we have done it. We're doing it.
Oh, Brakwami, Sebi, for the past 25 or something years of our Fourth Republic, we've not had a conversation strongly like we are having now.
Okay.
And so now that the conversation is there, Mr. Miniaji, because as a doctor or public health person, I know it is conversations that ultimately result in a solution. You see, all these years. Exactly. Because kidney from Sebi 80s up to now, and now because heart conditions for uniska cardio and easy. So my point is that all these things, other countries have thought of how to help people to address the problem. Look, my suggestion is to say, wait there, and yes, I buy idea, but ubet for 1 or 2 products are sebi and your young for na use the middle or upper class. Ultimately, bibi kakra 50 pesos po, 1 cedi, and any significant effect on the product. Now, so ubuas kananua, you can use it to subsidize care for kidney in all. You know, everything is syntax. Sebi alcohol and your automatic says sebi unum salvenia kidney disease, but the studies show that too much alcohol can worry the kidney. So ufa in Zambia, raga apio die odiko tu so be ankofo bibire. Enti enya apio, odi fa bakwa impenyufo no nom ebi a monkey shoulder blue label. Eno no bra kwa undru level bia unnum. Odi fa 1 cedi bi tu so.
Why any monkey shoulder no?
Bra kwa eno so ye ndro no bia omo mu tie mi no omo pe ndro no omo nim bra kwa so ufa enu se no da tu so bra kwa V power say obi a out of V power sebi obi a adom wonu so a no yedu enti odi 1 cedi koto V power so a brakwa me okobo enkame because me Suzuki no enye V power na kom now so omo nyame ahire omo no they would have found a way to support kidney. So there are many ways. The only thing among what my women say most of the time we don't talk to each other. We kind of 2 main political parties enti na ye kasai one for candle anko bon komo anaju ofia brakwa me a candle ti say okobo say V power 1 cedi pe obe press conference brakwa o catch a candle say me see for the past 13-14 years sika etua for processing fees for health insurance it has remained the same for 14 years.
How?
Ghana for more on SNIT omutua 8 Ghana cedis to register onto health insurance for the whole year. 8 Ghana. And omo nye aban adwuma no omutua 27 Ghana cedis. And the premium omutua for care from January to December 17 Ghana cedis. Now, Brakwami, what we Ghana ni what you are 8 Ghana cedis for 14 years. Hospitals use inflation achiwon. Oko boy there ni 7-8 Ghana cedis. Waji enu for 14 years. You call owom the same amount. We have to be realistic to ourselves. Brakwami because Kenya health insurance. CEO no ultimate you have for kidney transplant. Transplant. Health insurance. And I'm saying, how are you able to pay for kidney transplant? I say, doctor, we have money. Every worker in Kenya, about 3 or 4% of their salary is transmitted straight to health insurance fund. Program, 90% of the money they use to run the fund is in their accounts. Only about 5 to 10% and Omutuan Minister of Finance were. Ghana, the 90 to 95% comes from Ministry of Finance and SNIT. Enti da omo be chom kakra ye chom no chesa semaba. Enti we can have healthy discussions both parties. Let's have a frank conversation. Me okoboy sky to me say me gi 10,000 Ghana cedis. Oji 3-4%. I will pay more than Sebi mo security man oji 700 Ghana. But me sika no na be boa man yiri hospital I hwe ni yie. You know, that is how countries have developed their health system. But on my way, because of politics, sa 8 Ghana cedis now, me see Ghana for Tiano. Unim now they call 10 cedis. I can't bet you. Now, one day, in the next 16 years, say akando mobile power omo di koten amesu mechi akando say it should not move. And because of politics we have stayed at the same place when all the solutions are staring at us in the face. Me and you know one major problem health insurance anyani say from President Kufuor to today. Sika yeji in the name of health insurance. Ni nyina emba health insurance.
Go ahead.
Right, say yeji 5 billion na e 3.5 billion. Only maybe 1.5 no call.
There we.
Obe won e bia ko roads. E bia ko to fertilizer. E bia ko sanitation. I bind the supported the brother friend budgetary support. Just a sika I buy here to run the expenditure no and the program no. On yes as can na enti before you sika ni bi e the cost so. Sa practice ni ntinu anytime obeka say obese unto health insurance kamu kakrape na politician say debi men fa sanka until mudi sa scan nyina bema health insurance mamu dream say mudi ska bia beba ya use sa excuse no bra crime for 20 years. So bra crime mesre we can do two things when we the politicians. I know Nana Akufo-Addo will find it difficult to do it alone. All of us must come together. We must decide bra crime and two things can be done where frank conversation bra crime.
Yeah.
Obe no be that go to internet. Oh, Okobo say finance minister should impeach. No. Bra crime. Frank conversation. There are two things we can do. The law currently, I can say, yeji insurance canal within 30 days.
Yes, so.
No finance minister has honored it before. The law says that every 6 months the finance minister must come and give an account of Skawaji in the name of health insurance. No finance minister has honored it before. But nobody has questioned the finance minister because Sebi, from Rawlings up to today, you need more than half of parliament, if I'm correct, before you can try to censure or say they should remove anybody who is a finance minister. But if the law is amended, say you about together as a country, now you can say, oh, you need only 1/5 of parliament. Every opposition can always get 1/5 of parliament. Me a finance minister, now me said this is the rendition. Ebe didn't say me sabeka health insurance car. Say dear from President Kufuor up to now, obia based on the love for health. Any send or dream ye super health insurance. Or no chere sika do ordinary or scanner. So we can immediately let all come to us. And I've said at many places, if we get 90% of what is collected in the name of health insurance, we can pay for kidney care in this country.
Now, how about BBS your friend co-pay? My dream home. Ebia na met me a trebi.
Yes.
I don't know, so co-pay at the end my dream home.
Me say politics are na high. Didn't na make us co-pay. Yedi President Kufuor insurance buy. Obiko hospital na oyali Malaya. Yamane drone na mu yedi nti agino yedi nsu ato no so 3-4 days. Ye discharge no na e bia ye say watu 10 cedis per. Say you can say insurance na nyejuma. Say na watu sika. Enti ade na quite said here politicians can say and was say 1 cedi crown free nipa no ho. Say 1 cedi bape insurance dey go. But because of political when intinu obia ba say o menji sika bia wo Ghana ni bia ho meanwhile obehwe no hospital no so bread because of some factors now only bibi me the professor bi kasai okoye PhD to America osi odu America na ka chen say our health insurance worth $100,000.
Okay,
they can spend $100,000 on his health check up operation anything in a year, but any to hospital no he will co-pay about 1%, which comes to about I think $1,000 or so. $1,000 no bet you into one for hospital and all you the PhD. You see, sometimes sika kakra obi tuano it serves as a deterrent.
Yeah.
So that nipa no abuse the system. But politics intinu ya didn't free. Inti mi wo chebi am ye doctor no. Braka mi minimum bi obesra me. Na ko boy mi hwe na mi say o bowa. O wa idie. O bowa enye yellow. Wan kasansu utimi didi usi we didi okra no pay. Enti wade no mu nya di num suohie bibia be fine ofri chebia or call sino wa be use health insurance o ama health insurance betua consultation fee oduro sino a obeka che nurse say abrante bia wa ba chebi kasa bebre dro ba kokra o mame na wa call sino o sino hwe na doctor no be ma no para say o you don't need antibiotics. Anti-faparano, it will be fine. Ofrosino or call I didn't tell because a drone does until obviously Sandro Bebri.
Ah, the heading.
Brother, say psychologically, no. Dr. Emmanuel Drobebre no or being. One patient who have visited 3 facilities for the same condition. Health insurance will pay for all the 3. But Anka, your provisions actually say condition here show no health insurance to ya, let's say 100 Ghana cedis for malaria. Your task is to pay 1% of the 100 Ghana cedis for coming to the hospital. Ebe keeping a lot of errant behavior away from the clinic. And guess what? We can also put a provision actually say, oh yeah, indigent, obi own niska. One city no better me, I prevent you from coming to the hospital. Go to the same clinic. There's a unit that will take your details and register you and give you a card. In Pembebre, no, would you be far through that process? Only the true indigents, poor people, would come for that service. And the point I'm making is that if we leave a lot of the politics behind, the partisan politics, and engage in frank conversation, a lot of things will improve in our hospitals drastically. Because look, meaning patient be obeshami or lekma. Mama no do a health insurance no. Only doctor check me. Doctor. And yes, I mean Jimon do na. Only me draw people bet me aboa me boy dia. Still with the trauma me ameka koto. It's the psychology of the mind. We are human beings. On gene this say wabet na me nima or the card keka aba no. Ya man with 4 different drugs. Something tells him that the drugs either will not work or it's not real.
How?
But it's the psychology of the mind. So
just a young
we need a lot of education. But my point is that we can pay and improve conditions in our hospitals if we look, Fachemi, there was so much politics. A past government said, when I come, only 1-time health insurance.
Yeah.
But when that government came, when you go and check, for close to 12 months, now most hospitals, Omunya paid to pay them for healthcare. And Ukra Kauma, some of the hospitals saw it normal to charge money. Everybody just can't say, Abeye chronic. Say, me mom muskakra. They can't believe, say they have to stop taking the money. Because Sana Abrabono, why for a long time. So, my point is that if anybody tells you health insurance is not working in Ghana, Sebi, Ebi Panukra government hospitals. That's what I've realized in this country. Obi to because say insurance they go. Me wa call like man pay ya. Obi your operation insurance in Sebi. No one go no kakra. Obi ako OPD. My point is that insurance is not perfect now. It can be improved. All it takes is a conversation like we're having now, like we'll be having the next 2-3 days. If the partisanship ever from kakra, we can do wonderful things. Ask yourself, how come kidney has not been paid for over 25 years of the Fourth Republic? It's because we don't engage in frank conversations. Who's an everybody? Obisi or man be more akwara oyari want me to your kidney. Yeah, an interview or radio super the next day we. Oh, if you are now seeing it, then either you have not been around or you don't know what is happening. In fact, apart from enonomaka heart conditions, obi or heart condition or kolebu on this car or the enti as a country, let's look at how we can support these people. At health insurance, we've set up a committee to look at how to support people with chronic peripheral diseases. Health insurance in cover. In fact, let me disclose here that your budget already year health insurance this year. Here the call parliament, Dr. Koboy, with the blessing of my board, we put in one line, peripheral disease fund.
Peripheral disease fund.
Before even this dialysis conversation started, why did we bring in that? I convinced the board that although our mandate is to pay for care which is captured in our list, we cannot sit down unconcerned, as people with chronic diseases continue to come on TV and social media. No. I told them if we can even have 1 million Ghana cedis as part of our budget lines, it can attract. We can set up this fund. Private people can support the fund, and every year applications can come from citizens and we can support them. But our budget normally must go from board to health committee. Only what happened at the health committee. Health committee for the catch and say, doctor, why you won't say anytime I won't be beer, free say cover no. Why you won't jiman? Una osi ukwakotia. Their beef was that it is the responsibility of Ministry of Health. This is the argument. to see how the health ecosystem can be improved, and that the law only mandates us to pay for what is on our list, and to do studies on those that the ministry would throw at us, and that we should not go fishing for conditions. So the point I want to make is that even before this dialysis discussion came up, even we at the health insurance were trying to find a way, to help reduce the burden when it comes to some of these chronic diseases. Cover.
When you be a friend, Dr. Kokrokoo.
Board chairman.
Chairman General, tell my chief executive Bernard Okoboy that I greet him on your show, and that his strategic acknowledgement of the governing board will earn him deserved attention, quote unquote. Dr. Kokrokoo.
If you said in Yamina Dima, Omudi Amibo Bebreno and Yakwa, never confer pressure number form.
Or see what yes, you were into our Bobo, do you know? What Okoboy is saying is true. Sometime back in the northern part of Ghana, they only accepted topaye as black and red. They called it abon belt. Any other color of capsules is not accepted. In the Volta region, in the eastern region, Kwame, even in Tema, if you take topaye, that's all they know, black and red, abon belt. Even in Tema, if you give them anything else, which not black and red, they say Dabi. And yeah, Papa, just to buttress your point.
Yeah, you know, and a lot of education is required. Obi owa omano amoxicillin because it's so sebiya used for many years. No, obeka say oni jide omu. When new drugs are by what is a kefirosime niniama. The fact that you develop a drug before does not mean a better chain. Sebi, titindro. And we face some of these challenges in the hospital. Now, me point in this say, it is always better to go to a recognized hospital. We can't recognize because Fachem say your hospitals are able to need doctor, but say you on call medical school.
Yeah.
I always recommend, even my close friends, I recommend government hospitals, Reach, Kolebu, and all that. If it's a private hospital, it must be a recognized hospital, Sebi, Omunye, Omunyama Kama. Once you go to the hospital, you are likely to get a good health care. One thing about Kami, later I remember on common say, screening. Kwa yefa so ayehwe obia apomudi e wo Ghana ha e wo form kakra. Rakami ye kosra South Korea. Population was South Korea. Omunim every adult omunim say na the blood pressure etie. And omunim the number of people who get high blood pressure in the next 5 years. More blood pressure so was so no. They know the number of strokes they will expect in the hospital and how to reduce the stroke. Rakami Chrome high kasai pa se Ghana nim for hospital obi anim the ordinam. These are not things so sebi beyond us. Like I always say, it all starts with a conversation. So that in fact, my prayer and say your blood pressure reading should even be connected to you being available at your job. If we don't know your blood pressure, you should not be working. Because if you are a CEO or you are an entrepreneur and Obi to say chairman general, our asset for you, the blood pressure was so now Nima. It's worrying, So these are all conversations. Now, as I speak, out of 10 for every 10 deaths that occur in Ghana for adults, 6 are related to blood pressure and diabetes.
Wow.
60% of all adult deaths in Ghana are connected to either hypertension or diabetes. That alone tells us where we have to focus our energy. Bills now buy insurance. They do a now,
can't say consider apart from kidney, lab test, X-rays, brain aneurysm as well.
When na 80 Ghana cities now, I consider when now. That's what I said. Let's have frank conversation. As a people, you have a situation where you are asking, health insurance President Kufuor, they were not wicked people, Chairman General. Why do you think they put all diseases on it and left out kidney care? They were not wicked. Why did they leave out open heart surgery? They were not wicked. Why did they leave out prostate cancer? They were not wicked. They did the studies, and the studies show that if you put these conditions on health insurance, and it's the same 8 Ghana cedis a year, 27 Ghana cedis a year, and this same arrangement of the money goes to finance, what comes is what will come. They knew that within a few years, only on paper, they better say insurance where they cover cancer, they cover kidney, they cover way. Now so you have the bills back for every malaria. Insurance
intimate.
Junk insurance. Yes, insurance is a junker. Just say on paper, AFA. But only now Oshi under that insurance assemble too. So let's continue to have this frank conversation. Is it real to pay 8 Ghana cedis for 14 years? Is it real to pay 27 Ghana cedis? Uye worker in Ghana, unto aslit, yenfan is out on phones from January to December. Sika wa tu ase yenfan show, u prostate, u liver, u T, u BBI 27 cedis. I mean, once you know this is the real situation, then we know how we go about it. Now, I've always said that any law that is broken for over 10-15 years, that law itself is weak. They say law you breaking what Ghana 25 years in here. The law say scan for insurance. We have to find a way to correct it. And Honorable Abina Osei, she said something very interesting. I say, doctor, when we give you all the money, we give Get Fund all the money. Those monies are say cap, sometimes that's what they even use to pay salaries. That's what they use to pay goods and services. You know what she's trying to tell you?
David.
It means the monies we collect are not enough to run our programs.
Yeah.
So we have to be real. If we know it is 1.5 billion, and AIF our health insurance can averagely medical support budget now, then let's find another line where we can raise that 1.5 billion and give all the money to health insurance. But what I say, I don't know what I get me.
Yeah.
Say you've been taking some parts to support the budget, but because of that practice, ama obia who person will increase your tariffs. Not politicians say don't touch it.
Don't touch it.
So me my advice in this about me to allow Okoboy and Akando and all health related people to give the health insurance its space to be real. No, let's find a way to finance that gap and let all the money, so that if all the money is coming to us and it still cannot pay for dialysis, now we can go like, look, now let's increase the levy, or let's increase the processing fees we charge, or let's look at the premium.
And so no pay aluta baba.
Say until you find a way. But by the way, this year, Sika Sebi, I have to also say that Honorable Abina and the boss, my name say, for some reason, we've had quite substantial releases. Into the hospitals, baby, from behind the scenes. Nyama ma. Oh, Mikowa, Upper West Regional Director. Missy Regional Director, Hospital Director. No. Me di unim do kan. Say, and say there. You want who na in a month let me to twice.
Say monyeska.
Exactly. Enti but I'm looking at things that will ensure consistency, sustainability. These are the conversations we have to have.
Bernard Okoboy, Chief Executive, National Health Insurance Authority. Obviously 8 cedis a month. Kwame, in the Czech Republic,
a year. It's Ghana a year.
I pay 140 euros every month for myself. Amadu Alasan, Czech Republic, and that's Czech. Here, if you say you pay 100 cedis a year, choboy, yeah. I see. Well, Dr. Kobo and Medasi, this is very interesting. Very, very interesting. Medasi P.
Yeah, can't help that. You see, the frank conversations ni niama nyina no. Some community me pese me sen komo no. Enti de me senior brother ni me uncle. Honorable community honorable practice ba no. Me mfa me hu njim. Me free me ko ejuma.
And now you're politician.
Okay, na me nye ebia yɛnhwɛ Friday.
Measure when him. Dr. Kobo